What's past is prologue. William Shakespeare, The Tempest. Those who cannot remember the past are condemned to repeat it. George Santayana, The Life of Reason. Oh, when will they ever learn? Pete Seeger, Where Have All the Flowers Gone? Hi, I'm Frank Speidel, and welcome to The Doctor Is In. I'm a retired emergency physician and recovering hospital administrator. In this show, with the help of guests, we explore healthcare in the United States and its interface with our society. I invite your robust skepticism of my comments. I'm human. I make mistakes. And I recommend you seek guidance from your primary physician, state and local health agencies, and the CDC for your healthcare decisions. In September, on 60 Minutes, President Biden declared, "The pandemic is over. We still have a problem with COVID." Just COVID, Mr. President? What about the devastation left by the pandemic and by our response to the disease? I think our response has shown us at our best and at our worst. Let me share the best. Best, those at the bedside, seeing and touching, caring for the patient. The first responders, EMTs, paramedics, the police, and especially the women in med who are at the bedside taking care of the patient. Before we had vaccines, they were there 24/7, 7 days a week, and guess what? They didn't take holidays. Along with them, day after day, were the cashiers at our supermarkets and convenience stores, protected by a flimsy plexiglass barrier while we were lined up waiting for our collection of food for the week. There is intense competition in the worst category. We've been through hell. We've lost over 1 million Americans. We made them fear the coin of the realm. We have hobbled a generation with insecurity. We have cratered the education of our children. Such a disaster demands ruthless inspection of what we did well and what we did poorly. Through every aspect of our society, we have seen failing performance. Let's look at them. First, the media. Reporting has been abysmal, lacking specificity, lacking precision. We read about the generic term masking, but wearing a loosely fitted cloth mask is substantially different from a properly worn and fitted N95, but we still hear of masking as a generic term. We are told some test is accurate, but not its specificity and sensitivity. This failed reporting may reflect poor science backgrounds of those reporting and producing the news. Reading a much-hailed report on a study with no statistically significant difference in the treatment arms leaves one both laughing and crying. While one cannot reasonably expect fluency with direct notations, familiarity with the utility of null hypothesis testing ought to be a job requirement for science reporting. Regrettably, sophistication and nuance do not jump to mind when looking at pandemic reporting. More importantly, in the time of pandemic, getting it right ought to be more important than rating points. On Friday, 21 August 2020 at 5:15 on Health Checks, the anchor, Rick Williams, reported COVID-19 is taking an ever higher toll among those under the age of 40. Further in the broadcast, Mr. Williams reports on an article from the Mass General Hospital reporting that children are super spreaders of COVID-19. In fact, neither statement is true. The assertions arose from a sloppy reporting of a prepub of a Journal of Pediatrics article by Yonker et al. They call it the Mass General study. The study was an observational study of the viral load of asymptomatic and mildly symptomatic children. They said in the study, quote, "The study reveals that children may be a potential source of contagion in the SARS-CoV-2 pandemic," quotation mark. This is a make-good observational study. Its value is to invite consideration of the subject. It offers no conclusions. In fact, the word super spreader never appears in the article. Unfortunately, The school of if it bleeds, it leads does not give way to accuracy, even in the time of pandemic. It's entertainment, not journalism's. Rating wins over the truth. Public health. At the start of the pandemic, Dr. Fauci set the tone of authoritative misinformation from titled sources. On January 28, 2020, Dr. Fauci advised, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of the outbreaks. Really? Around 40% of COVID-19 transmissions are from the asymptomatic. Wrong observations have danced through Dr. Fauci's long career. Almost 40 years ago, at the start of the AIDS pandemic, in the May 6, 1983 issue of JAMA, the newly installed head of the National Institute of Allergy and Infectious Disease, Dr. Fauci, authoritatively mused, AIDS might be transmitted by, quotation marks, routine close contact, quotation marks. Amusing, both wrong and harmful. Undaunted, he assured us on Face the Nation just this past June that attacks on him were really criticizing the science because I represent science. An interesting comment telling us much about Dr. Fauci, especially given his decades of authoritative, harmfully wrong musings. Beyond Dr. Fauci, the CDC added to the confusion, mandating only the CDC test could be used to diagnose COVID. Problem was they didn't work. Initially, the CDC had us spraying Clorox everywhere. We had to prevent fomite transmission, So deep cleaning, classrooms, that's what we're going to be doing. I have a standing offer of a Freddy's large chocolate milkshake to the first individual who can show me a documented case of fomite transmission. After backing fomite and droplet transmission, the CDC posted and then immediately retracted recognition of aerosol transmission of COVID-19. This is all the more noteworthy and cringe-evoking because in 1994, the CDC recommended N95 masks only for those treating tuberculosis. Why? Because the CDC recognized the aerosol transmission of tuberculosis, an agent 1,000 times more massive than the SARS-CoV-2 virus. Would it be too much to ask the CDC to be consistent? To remember what they said in 1994? To her credit, on April 4, 2022, Dr. Rochelle Walensky, director of the CDC, announced the initiation of a sweeping review of the nation's public health agency. A healthy act by our leading public health agency. Come to those we elected. At every level, shortfalls in performance. While Warp Speed, multiple contracts with guaranteed purchases, was bold and effective, this was negated by mandates, unbacked by science. No surprises here. Remember, the Secretary of Health for the Commonwealth of Pennsylvania during the pandemic is an attorney. Now, to their credit, many elected officials admitted they were not prepared for the pandemic, and many sincerely desired to be ready for the next disaster. But I believe preparation for the next disaster begins with ruthless review of past performance. And I think we are failing here massively. The review ought to be done by those with competence in the subject matter and demonstrated experience and success in responding to disasters. And the reviewers ought to be independent from the organization they review, not looking for the next consulting contract. Sadly, the tendency is to write a contract for a consultant to review the organization's response to the pandemic. Usually, the consultant finds everything was done correctly. It was a pandemic, So move along. Nothing to see here. The danger is when things get shaky and challenged again, and they will. The prior poor responses and failed decisions, unrecognized, will reoccur again. No learning from mistakes, only fresh coats of whitewash. And as I wrote today's introduction, there was the release of a prepub from Boston University's National Emerging Infectious Disease Laboratories. To some, this seems like a gain-of-function study research performed in a biosafety level 3 lab, the same as was used at the Wuhan Institute of Virology researching SARS viruses. Our guest today is Dr. Beth Ann Rosica. Dr. Rosica has been a tireless advocate for children, even before the pandemic. One of the delights of producing and hosting this show is meeting guests that amaze. Dr. Rosica is one. She is a wicked smart individual, terrifyingly knowledgeable of the medical literature, and her values are those values that move our society forward. Dr. Rosica, welcome to The Doctor Is In. What did I get wrong?
Well, thank you for having me on the show, Frank. It's always a pleasure to spend time with you. I don't think that you got anything wrong today to start us off.
You've been a guest before. In the spirit of review and performance of what has gone before, what could we have done better on The Doctor Is In? What do we fail? What do we get right?
In terms of On the Doctor Is In, Frank, I think that your show has been one of the bright spots in our media to at least raise awareness and to ask questions and to invite critical conversation. You've had guests on that you haven't agreed with, but you've explored their perspective and their opinions and asked them what evidence they have to support their position. So I think that unlike most of the media that we're encountering in our country right now, yours was very fair and balanced and offered multiple perspectives for people.
Let the record reflect that there's no compensation going to you, Dr. Rosica.
Correct.
What did we learn from the pandemic? What did we do poorly? What could we have done better?
Well, I think that is such a long list that we won't have time to get through all of those topics today. But I think that the biggest takeaways that I have from how we handled the pandemic is that we forced the most restrictions on the people who were least at risk for getting sick and dying from this virus. And I'm talking about children. We knew very early on that children weren't being impacted by this virus in the same way that elderly people were, people with co-occurring conditions. We knew all of that very early on. And, I can understand in the first couple of weeks, even the first couple of months of the pandemic that, people were scared, governments didn't know what to do. But very quickly, we had information to say that we knew where our vulnerable positions were, and we should have done everything we can to protect the elderly, which we did not do. We did not protect all of those people in nursing homes. We sent many of them to their deathbeds with decisions that our own governor here in Pennsylvania made. And we completely restricted our children. And we are seeing dire and devastating consequences from the decisions that were made about our children.
Tell me some of the things you're seeing that's happened to children, to our future.
Across the board, I tell people this. I wrote Governor Wolf a letter on April 11th, 2020, predicting a number of things that would happen if he did not reopen schools. And to be clear, the school district that I'm in, Westchester School District, we were not fully reopened for a full year after that letter was sent. So what I told Governor Wolf was that we're going to see not only incredible regression in academics, we're going to see regression in behavior. We're going to see significant mental health issues, the likes of which you've never seen. We're going to see our suicide rate amongst young people skyrocket. We're going to see domestic violence and child abuse skyrocket. We're going to see eating disorders on the increase. We're going to see parents who cannot take care of their children, or we're going to see parents have to make a choice between going to work or having their children go to school. Things that parents would have been arrested for child abuse prior to the pandemic were just normal occurrences, leaving 5- and 6-year-olds home alone because they weren't able to go to school. So the results have been devastating. The academic decline amongst our children, they've lost 2 years. And, I tell people this all the time. My kids are going to be okay because I have the resources. I have a PhD in education. I can make sure that they have what they need to get caught up. Any mental health issues, I can afford a psychologist for my children to go and see to make sure that their mental health issues are being addressed. But we have so many vulnerable children, look in Philadelphia, that have been so disproportionately harmed by these policy decisions, and nobody wants to talk about that.
Beth Ann, you are so spot on about this. Martin Kulldorff from Harvard said way back in 2020, that he's one of the great Barrington Declaration heretics, said that the problem with this course of action was it was regressive. It would have the greatest impact on those with the least resources who have already been marginalized and abraded by society already.
Right.
It was going to hit those people that we want to try to help to a better situation. We knew that back in 2020. I am so disappointed that the response. I can remember back in the spring of 2021, vaccines have been out there, seeing in one school district the requirement that people at soccer practice outdoors wear face masks. There's virtually non-existent transmission outdoors. The face masks were these little flimsy floppy things which have minimal, absolutely almost non-existent efficacy. We like to think they do because we like to think it doesn't. And on top of that, people were angry if you asked them questions about that. Right. If you raised the question, you were either an ist or a obe. You were a something ist or a something obe. You hated something. You mentioned you writing to Governor Wolf. On those we elected, I've noted a disturbing pattern. There is a tendency to cite unimpeachable sources during the discussion, and they're not in the room. You can't ask the question. I had the experience one time of being able to ask the question because I knew the unimpeachable source and sent them a text. And they commented, and what their comments were 180 degrees out from the course of action that the elected official was advocating. Have you had a similar experience?
Absolutely. I mean, I think that, anytime we've asked questions about the research behind decisions that are being made, whether it's a school district, whether it's a county health department, they have no answers. I mean, the Chester County Health Department, there's a parent who put in a right to know request asking for the research that led to their recommendations of face coverings for children at school. And the answer was those records don't exist because they have no research to support their policy recommendations. I mean, during all the school closures, the school districts would say, well, we're not opening because the county health department, Chester County Health Department says, we shouldn't open. And the county health department says, well, we're not saying that you can't open. We're recommending that you shouldn't open. That's very, very different. And it was just all a big finger pointing game. Nobody could actually point to any real research, any real evidence to support the decisions that they were making.
As we were watching people reach escape velocity over 3 feet or 6 feet separation and the plexiglass shields, all this for aerosol transmitted agent, I was stunned that nobody mentioned air exchanges. To me, if we had to do it over again, the first thing I would do was spend the money, brought in massive air exchanges, bring the same level, because we handle infectious airborne agents, aerosol agents all the time in hospital suites for interventions, and achieve that standard there. Interestingly enough, early on, I believe that one of the things that happened early in the pandemic that caused some confusion was 3 people were on a flight that were thought to be symptomatic. And the flight got underway, and they were physically separated. There was a couple rows of separation, and they were kept in one part of the plane. And miraculously, no one on the plane flight converted to being COVID positive. Well, physical separation is the way to go, and everyone had masks on. The fact of the matter is, the air exchanges in a plane in flight are massive, and they go through a very powerful filtering system. That's why we don't see transmission on board planes. There's much to grow and learn here. Going forward, what would you recommend we do? How can we get ourselves to a better place?
Well, I think that's a tall question to try to answer in our short time, but I think that there are some key pieces, and I'd like to focus more on the broader areas rather than the specifics, because this issue about being able to ask questions, that's a really big deal. I mean, our country is based on the idea of asking questions and having differences of opinion. And what we saw during the pandemic was that not only are you not allowed to ask questions, but if you ask questions, you are an enemy of the state. I mean, we saw this we're celebrating the 1-year anniversary where the U.S. Justice Department called parents who spoke out at school board meetings domestic terrorists, because that is the level that we have reached. We have sunk to this low in our country that if you disagree, if you have a different opinion, if you ask a question, you are an enemy of the state, an enemy of the narrative, and you will be shut down. Our national media sources continue to present very, very biased views and don't allow for honest exchange of ideas. And I think that has been the epic fail of the response to this pandemic, is we have limited people's freedom of speech, freedom of thought, and the ability to ask questions.
No one succeeded in quelling you. No one succeeded. They're running out of duct tape, Beth Ann, and I delight all the time. You are willing to ask the hard questions and to get information, real information. What are your thoughts about the media? Is this something that Frank Speidel is just on his own little crusade about? I think the reporting's been horrible.
No, I think the reporting has been so terrible. And, one of the interesting pieces is that, I'm older, and, when I was young, the news was on for an hour a night. There were regular TV shows on, and you got the news for an hour. So the news that was presented was the most important pieces, theoretically. Today, in our 24/7 social media, 50 news channels that run 24/7, people are constantly looking for stories. You're always looking for something to put out there. And I think that everything has become so diluted, and there's no fact checking. There's no, let's really look, is this a story worth running? It's all the sensationalism. We need ratings. We want people to watch. We want to have something to say. So all of a sudden, everybody's an expert, and you can put anything on, and people take it as it's the gospel.
Some station manager who I was in a correspondence with, who's a local station manager for the broadcast news networks here, made the comment when I wrote to him expressing a concern about just absolutely flat out erroneous reporting, which was lurid, that it's really tough trying to sort out all these different opinions, all these different statements. And I understand. I greatly appreciate that. Trust me, there's some things that are not easy to do. We all know that. I was terribly disappointed that it always files to the most vicious, lurid, and wild, frightening things are what makes the news. Right. That a straightforward report that says kids could spread, but there's no evidence that they do, becomes all of a sudden they are super spreaders. Exactly. We go for the hyperbole. The hyperbole.
It's all the hyperbole.
Thank you. The time of hyperbole. That is really it. Have there been any heroes for you in this? I always see the bad things. My heroes are the people that were looking at that 20 deep line of people getting their cans of Spam and Diet Coke as they were checking out, just protected. I mean, they came in every day. Mm-hmm. They took care of us. They checked us through the Giant, through the Acme. Yeah. Did you have any heroes?
Oh, I think there were a lot of heroes. I mean, I think that, people believe that I'm super critical of teachers, and I'm not critical of teachers. I think that many of our teachers were heroes through this pandemic, being forced into a horrible situation to have to teach online and deal with all of the nonsense from the school districts that they did. So I think many of our teachers were absolutely heroes. Certainly all of our workers in these long-term care facilities, going to work and trying to deal with a situation that they didn't have the supplies, they didn't have the training, they didn't have most of what they needed, but yet they still showed up to try to take care of the elderly that were in these homes. Other heroes were people who would speak out. You know, you talked about the doctors from the Great Barrington Proclamation. Those are heroes. Those people are heroes because they had so much to lose, so much to risk, their reputation, their medical career. Many of those doctors were fired. They were shunned from the medical community for stepping up and standing up and saying, this is not right. You're not showing all sides of this. You're spreading misinformation. And so those are the heroes to me, particularly those people who are willing to risk their reputation to do what was right for our country.
I feel the same way. There have been many people that have fought the good fight, that have raised their voices. When I was growing up, it was speaking truth to power. Mm-hmm. I think the expression for these days should be speaking truth to dumbness. There's a certain frustration. You cannot invent this incredibly disproportionate response. It was a disaster. It was a pandemic of killing people all over the place, especially our older folks. But the ability to respond to it in a rational way, driven by science and not fear and not by propaganda, we kind of failed on it. Next time, I hope we can fix that.
Well, and I think that in terms of the other big takeaway is that we need to trust people to make decisions about what's best for them and their family. The government was far too involved in making mandates that then people became distrustful of, and we had every reason to be distrustful of those mandates. But provide education, provide facts, and let people make their own decisions. We are smart, intelligent individuals and parents, perfectly capable of making decisions about what's best. And we understand what the risks are. And let us make those decisions.
We are not a state-oriented society. We are growing that way, unfortunately. And thank you, Beth Ann. In closing, with all we've been through, with all we have lost, especially those we have lost, for them, we must critically, vigorously examine where we have succeeded, where we have fell short, or we will do it again. Thank you for watching, and be safe out there.